Today we are talking about how to do tidal percussion. Before going to the tidal percussion, I want to tell you about the normal mechanisms, what all happens during breathing. So breathing, as you know, expiration and inspiration. Expiration is a passive process, inspiration is a active process. What happens? This happens mainly we concentrate on the diaphragm. So diaphragm, what it happens? During inspiration, it pulls down the lungs. It pulls down the lung. And during expiration, the lung will pull the diaphragm up. So the shape of the diaphragm changes. During inspiration, it is flat. During expiration, it is dome shape. Okay. So for that, what are all the things required? One is the contraction of the diaphragm. Contraction and relaxation should be there. And number two is the intrapleural pressure. Intrapleural pressure is negative in all the time. Both inspiration, expiration is intrapleural space pressure is negative. What does it mean? The diaphragm and the lung are together. The negative pressure holds it back. So it cannot get separated. So the negative pressure, that's the reason why when the lung go up, the diaphragm goes up. When the diaphragm pulls it, lung comes. Are you able to follow what I am telling? Right. Next is the lung. The lung, the lower portion of the lung should be normal. It should have expansion and shrinkage. Both should happen. Shrinkage during expiration and expansion during inspiration. So this has to happen. Now this I am talking about the normal mechanics, what happens during respiration. That is during breathing. Now, when it is happening, in the image I have shown you the pleural recess. The pleural recess is the one which contains potential space. There is no lung. So when the patient takes the breath, the lung expands and the lung descends into the recess, the pleural recess. So what happens? The resonance. Usually we talk about diaphragm by looking at the level of the liver dullness. Liver dullness is the one which tells you where is the diaphragm. As the patient takes the breath, the liver dullness is seen at a lower level. It is not that liver is descending. Liver is not descending. It is the lung which is occupying the pleural recess. That makes that means the potential space in the pleural recess is occupied by the lungs. That is the normal mechanism. So now, for this to happen, when the patient takes the breath, the liver dullness goes down. That is a regular teaching. For this to happen, you need negative intrapleural pressure, normal lung expansion, normal lung expansion, and contractility of the diaphragm. Diaphragm has to contract. Then only all the three should be there for it to happen. The liver dullness descends down 1 or 2 spaces when the patient takes the breath. That's all the test. If this happens, patient doesn't have anything pleural effusion is not there, lung is expanding, so there is no lung fibrosis, there is no pleural fibrosis. Is it clear? That's all is the test. So one example I'll give you. For example, cirrhosis of liver. What happens? Ascites is there. At that time, what happens? The liver is pushed up. So dullness, instead of being in the 5th space normally, it may ascend to the 3rd space, 4th space, depending upon how much is the tenseness of the ascites. So at that time, even the patient takes the breath, still it goes down. Even though it has gone up, it goes up when the patient takes the breath. Unlike in pleural effusion, what has happened in the pleural effusion? The negative pressure, intrapleural pressure, when the fluid starts accumulating in the pleural cavity, the negative pressure disappears. It becomes positive pressure. So the diaphragm, instead of dome shape during expiration, it remains flat. So for the diaphragm to become dome shape, it has to be negative pressure. Lung when it is shrinking, it should go up along with the. But here in the pleural effusion, what happens? it becomes positive pressure. So the diaphragm remains flat both in inspiration, expiration. That's the reason why this dullness, liver dullness doesn't move down. Liver dullness or the pleural fluid dullness. Pleural fluid dullness, what we are talking, the pleural cavity, pleural effusion. So that doesn't come down even on inspiration. Inspiration, it should go down because lung is expanding. That is not happening. That's all. In a patient of cirrhosis, if this doesn't happen, that means the pleural effusion is there along with ascites. If it is going down, that means ascites is there but not pleural effusion. That's all the test is. Simple. Now how to do it? We will demonstrate how to do the tidal percussion. So this tidal percussion can be done anywhere on the chest. In the front, in the back, in the sides, anywhere you can do. But preferably on the right side, we do because the liver dullness we know where is the liver dullness, fifth space. Whether during inspiration it goes down or not, we have to see. You can do it in the lying down posture also, in sitting down posture also. In sitting down posture, if you do, what is the advantage? The liver will go down. The diaphragm descent is better than when the patient is lying down. Because if the patient were to have the ascites, it presses and it prevents the descent of the liver. Okay? So, now you have to do one minute. So, you do in the mid-clavicular line. You know the mid-clavicular line. Start percussing from the space number 1. 1, 2, 3. No, that? 3. Okay. 3 it is, I am getting the dullness. So, third space onwards I am getting the dullness. Now I keep my finger in the third space. Ask the patient to take the deep breath. ತಗೊಳ್ಳಿ ಉಸಿರು ತಗೊಳ್ಳಿ ದೊಡ್ಡದಾಗಿ ತಗೊಳ್ಳಿ ಹಂಗೆ ಇಟ್ಕೋಬೇಕು ಆಯ್ತಾ ತಗೊಳ್ಳಿ ಹಂಗೆ ಇಟ್ಕೊಳ್ಳಿ ಬಿಡಿ ಸೊ ಯು ಟ್ರೈನ್ ದ ಪೇಷಂಟ್ what you want, you train the patient should understand what you are talking. It's okay. Now he understood what he is supposed to do. Then you do the test. Third space it is dull to percuss. Fourth space dull to percuss. Now usur tagoli sir, usur tagoli jorage. See it has become resonant. Here also resonant. Fifth space dull. What does it mean? Still it is moving. That means there is no pleural effusion. If it were to not to move down, that becomes pleural effusion. That's all is the test. So in tidal percussion, you differentiate whether patient has got pleural effusion or elevated diaphragm because of the ascites. That's all the simple test. Okay.